Good morning. Welcome to Bree's Science Lab. Today we're going to go over the spinal column made up of vertebral bones, and we're going to take a look at the sternum and the cartilage and how exactly that articulates with ribs. All right, so to start, we're going to look at the vertebrae. You have 5 different types: cervical, thoracic, lumbar, sacral, and coccygeal. Now, your cervical, you have 7 cervical vertebrae, and they're a little bit different than the thoracic and the lumbar and all the other types. Your thoracic, those you have 12 of because they articulate with the 12 ribs, all right? Then you're going to have 5 lumbar, and these are really big, and they're going to be a lot bigger than the other ones because they're at the bottom of the spinal column, so they have a lot more weight on them. Then you have sacral and coccygeal, which we don't have here, but those ones are fused. So those will help make up the innominate bones, and it'll articulate with those to make up more of that pelvic cavity. But those ones are fused, and you have 5 sacral fused and then 4 to 5 coccygeal, depending on the person. It can change. So to start, let's go over those cervical vertebrae. The cervical vertebrae are really fun. They're tiny, and they're going to articulate with the skull, at least the first one. And here is the first one, okay? So this is going to be your anterior tubercle right here. So this is facing anteriorly. And then this is your posterior tubercle, facing posteriorly. This is your vertebral foramen, or your vertebral canal, when stacked on all the others. All right. Then you have your superior articular facets, your transverse processes with your transverse foramen. Now, the transverse foramen are very important because they are only on cervical vertebrae. All right. They are only on cervical vertebrae. So that is a good way to differentiate different types of vertebrae, right? Now, this is C1, so this also has a name. This name is Atlas, all right? And so it's confusing. You might hear C1 or you might hear Atlas. How I remember that and axis, okay, because they're very similar, is if you're lost, you would first check your atlas, all right, because they have maps and stuff in those. And then if that doesn't work, you would go find a globe and spin it on its axis, okay? So anyways, kind of silly, but if it works, it works. This is C2 though, and it's very interesting and very easy to distinguish because it is the only one that has this dens or odontoid process, okay? And this articulates back here and allows for like motion, like shaking your head and stuff like that. It is said that this used to be the vertebral body of C1 until it evolved into C2. Now, C2 also has some of these similar functions and stuff. So you're going to have transverse foramen right here with your transverse processes, all right? You're going to have a kind of a bifid spinous process, and bifid just means it splits into 2, but it's really not that obvious, but this is your spinous process. And the spinous process always faces posteriorly, and it's easy to remember because you don't want a pokey spinous process going into your organs, so you want it to face out, so away, and so that would be posterior of the spine. Then you kind of have a vertebral body here, but not so much. And then you also have your superior articular facets and, of course, your inferior ones right here. Now, the rest of the cervical vertebrae look more like this. And they don't have any names you really have to remember, but they're obvious because they're going to have these transverse foramen, and that's how you know that it's a cervical vertebrae. And then this has a more obvious vertebral body right here, okay? And I'll show you what a bifid spinous process looks like. So this is a bifid spinous process right here. See how it kind of splits into 2? There you go. So now that we went over these 7 cervical vertebrae, now we're going to go to the thoracic. Now you have 12 thoracic vertebrae, and these each articulate with a rib, all right? And if you look at it, it kind of looks like a giraffe. So that's how I remember it. It looks like a giraffe, whereas the lumbar ones look like moose. Meese? Something like that. But it'll be obvious, and I'll show you when we get there. These don't really have any identifying characteristics, but it's not going to have the transverse foramen. It is going to have transverse processes, though, right here. Transverse processes. Superior articular processes with superior articular facets. Okay. Vertebral body, which again faces anteriorly. Your vertebral foramen. And then you'll notice this right here, when stacked on one another, this little arch allows for your spinal nerves to come out, as well as a few other things, but spinal nerves are most important. Okay, and there you go, one last look. It looks like a giraffe. And let's go look for a lumbar. Here's a lumbar. See how these articular facets face more medially, and that causes it to look like a moose. See that? Looks more like a moose. And the spinous process is not as tilted downwards or inferiorly. So you're going to have the same exact things: your spinous process, superior articular facets and processes, transverse processes, vertebral body. You also have, it's more obvious on these ones, but you have a lamina. This is lamina right here. All right, and a pedicle. Pedicle is going to be right here. That's more important in radiology, but it's there. It's good to know. And then if you look underneath, these are your inferior articular facets. So these face more laterally, and the top face more medially because they stack on one another. Now, that's all for vertebrae, really, but I want to talk about this. So this is your sternum. So you can actually feel this. If you feel your chest, you're going to feel a hard bone. This is it. This is your sternum, and it has a few different parts. It has the xiphoid process down here, the body, and the manubrium, as well as the clavicular notches right here, which will articulate with your clavicles, and your jugular notch right here. You also have this little line, if you can see that. That's known as your sternal angle, and it's at an important point in your body because lots of things go on at this level. And the level of the sternal angle, for example, you have your carina, which is where your trachea bifurcates and splits into 2 different airways. All right, and these are all costal cartilages, okay, costal cartilage. And these articulate with ribs. And as you notice, you have 1, 2, 3, 4, 5, 6, 7. These 7, okay, will articulate with the first 7 ribs. Now, the first 7 ribs are known as true ribs because they articulate like this with just 1 rib, okay? Just 1 rib, just 1 rib, just 1 rib. So those are known as true ribs because they have their own costal cartilage. Now, if we go down here though, you'll notice that these are not split. Multiple ribs are going to share these costal cartilage right here. And so that is why 8 through 12 are known as false ribs, okay? However, don't get tricked because 11 and 12 are actually also known as floating ribs. And that means that while the rib will articulate with the vertebrae in the back, the front part of the vertebrae will not articulate with any costal cartilage. So it's just floating down here, kind of like that. So it's just floating. So 11 and 12 are floating ribs, all right? But they're also considered false ribs because they don't have their own costal cartilage, okay? Thank you for watching, and please leave any comments or questions below.